friends, welcome back to All on Law. In this video lecture, I will teach you how to calculate what you call the ovulation dates. Okay, so let's start with this and see. And please, before starting, please do subscribe to our channel and please do share our videos on YouTube. Okay, so this is ovulation. So ovulation is nothing but release of egg from the ovaries, and if you know your ovulation timing, then it will help you to become a pregnant and to take a precautions also. So let's talk about this. We will divide into two categories. So this is about a woman who is menstruating. So her menstruation either can be a regular or either it can be irregular. What is regular? Regular in the sense every month she has a fixed number of days for a menstruation. For example, the most common is 28 days. Whereas irregular, the one month it could be 25, the other month it could be 28, the other month it could be 30 or 25, whatever. So the days are not fixed. Now let's start about this. First we will solve the problem with the regular menstruation cycles, and then we will move on to the irregular cycles. So remember, the most important thing over here is the number of dates that you are seeing. Nowadays you are able to see the what you call the kits are available. Before the ovulation, before the release of ovulation or ovulation egg, there is a release of LH hormone. The LH hormone is released 24 to 36 hours prior to the release of egg. So this can be detected in the urine through the kits. So that helps. So now let's talk. If your dates, you have to, how do you have to calculate? You have to see the first day of your menstruation from previous cycle periods, okay, and the first day of next menstruation cycle, okay. So for example, if it's the 1st of May, the 1st of May you had menstruation, and then on the 29th of the May again you had a menstruation. So it means you have a 28 days cycle. So now total you got 28 days. What you have to do is, there is a calculation for that. 28, if you subtract 17 days from that, it gives the number of day or number of what you call date on which there is a ovulation. So always remember, there is not always a fixed number. Here you can find is 11th, means from 9th onwards till 16th or 15th you can take as a ovulation period. So this is the day on the 9th of the May to 15th of the May are the period or the timing where you ovulate, and chances of becoming pregnant are more. Okay. Now let's talk about the other one, what you call irregular cycles. So if you want to talk about the irregular cycles, remember there are one thing that you have to know. What you have to do is you have to see the 3 cycles. You have to take 3 cycles from March, April, May, whatever. So looking at this, if it's a 25 days and this is a 28 days and this is going to be somewhat 30 or 25, whatever, these whatever you add, take 3 cycles and add them and divide them by 3, and whatever you get, make it as a solid number. Even if it's came as a 27.5, take it as a 28 or 27, whatever. So when you get the number, X number if you get, and then that X number has to be subtracted from 17, and then 7, whatever you get, the dates is nothing but your ovulation date, but take 2 days prior to that and 4 days after that. That means that is a period, ovulation period. Now for example, if the cycle is 25 days only and it's a regular, then you have to subtract the 17, then it gives I think around 8, right? So on 6th, from 6th of your cycle till 12th is the fertile period. This is how you have to calculate the ovulation date, and it's very easy. There are available kits available in the market that looks what you call level of LH hormone in the urine. So LH is released prior 24 to 36 hours prior to the this ovulation, and the sperm lives in the uterine cavity or in the female body for nearly 24 to 72 hours, whereas ovum lives only for 24 hours. That's it. Okay, so thank you so much. Do subscribe to our channel. Please take care. Bye.